Thailand. Everybody, please welcome.
Good morning, everyone. My name is Chantima Siriporananon. Today, I'm going to present in the topic of bond strength of a universal adhesive with different similar preparations under dynamic pulpal pressure. Nowadays, tooth color restoration is very popular in dentistry. The composite restoration can be bonded to do structure by using dental adhesives. Recently, a new version of one-water adhesive system called Universal or Multimode adhesives were introduced in the market. Manufacturers claim that it could be used in etching approach and self-etching approach. However, it has been shown that acid etching of dentine did not improve bond strength of a universal adhesives. In addition, the previous study demonstrated the chemical interaction of universal adhesive to dentine when applied in self-etching approach. Vital dentine is hydrated by an outward fluid flow from dentinal tubules due to positive pulpal pressure estimated to be approximately 15 centimeter water. And there were several bonding studies under a simulated pulpal pressure model reported significant reduction in dentine bond strength can be formed from dentine wetness by tubular fluid. With different surface preparations, the different characteristics of similar can be expected. The use of diamond burr and carbide burr was found to be more compact and denser than that produced by silicon carbide papers. There has been concern that very thick or rough similar may buffer the acidic primer and prevent the resin infiltration into the underlying dentine and compromise the etching efficacy of the primer to the underlying dentine. However, there were many publications show that there was no relation between similar thickness and the bond strength. To date, there is little information regarding the effect of different similar combining with hydrostatic pulpal pressure on the bonding performance of universal adhesives. The objective of this study was to evaluate the microtensile bond strength test of universal adhesive to dentine prepared with different surface preparations under dynamic pulpal pressure. The null hypothesis of this study is there was no difference among the microtensile bond strength of universal adhesive to dentine prepared with different surface preparations under simulated pulpal pressure. For two specimen preparation, 28 extracted sound human mandibular third molars from the patient age between 18 to 30 years old were collected. The teeth were stored in Thymol solution and were used within 6 months. The protocol was approved by the Faculty of Dentistry of Mahidol University. After removal of the occlusal enamel, the teeth were grounded with 600 grit silicon carbide paper under running water. Their roots were removed at 1 millimeter below the CEJ to expose the pulp chamber by using a slow-speed diamond saw. The pulpal tissue was gently removed with forceps. The pulp chamber was irrigated with 2.5% sodium hypochlorite solution for 30 seconds, followed by immersion in distilled water for 30 minutes to neutralize the effect of sodium hypochlorite. The occlusal dentines were divided into 4 groups according to 4 different surface preparations. A single operator was trained how to achieve approximately 100 grams of pressure using an analytical balance prior to perform the surface preparation. Group A, occlusal dentine surfaces were prepared with 600 grit silicon carbide paper at constant rate under running water for 60 seconds. Group B, C, and D, occlusal dentine surfaces were grounded using a coarse diamond burr, superfine diamond burr, and carbide burr, respectively, at high speed with copious water spray for 5 light pressure strokes in order to make a uniform surface. A new burr was replaced every 5 surfaces. After that, the dentine disc was attached to a plexiglass platform that was perforated by an 18-gauge stainless steel tube using cyanoacrylate adhesive. The specimen was connected to a custom-made pulpal chamber, then connected for simulating pulpal pressure with an infusion pump as shown in Figure 1. The hydraulic pressure was set up at 15 centimeter water, and the flow rate was controlled at 0.36 microliter per minute to simulate intrapulpal pressure and pulpal blood flow rate consequently. The tooth surface was treated with Clearfield S1 Universal following the manufacturer's instruction, then cured by using LED light curing unit. After that, resin composite was placed on the bonded dentin surface for 2 increments of 2 mm and cured for 20 seconds each layer. 4 resin dentin beams from the central part of each tooth were prepared into approximately 1 by 1 square millimeter with non-trimming technique using a low-speed cutting machine with constant water coolant. For evaluation of microtensile bond strength, specimens were fixed on an experimental jig, then performed using a universal testing machine. The data were recorded and expressed into megapascal. Then the surfaces were coated with palladium and examined under a scanning electron microscope to determine the mode of failure. The failure modes were classified into 5 types. First, adhesive at interface. Second and third, cohesive in resin, either adhesive layer or resin-based composite. Fourth, cohesive in dentin. And fifth, mixed failure. The bond strength data were organized and analyzed for normal distribution and homogeneity of variance using the Kolmogorov-Smirnov test and Levin test respectively. One-way ANOVA and Duncan multiple comparison tests were calculated. All analyses were performed using a statistical software system at 95% confidence interval. For the results, the microtensile bond strength value and standard deviations of all experimental groups are demonstrated in Table 2. The type of surface preparation had influence on bond strength, with p-value less than 0.01. The microtensile bond strength to dentin prepared with superfine diamond burr showed significantly higher than other groups. However, there was no statistically significant difference among other groups. For the mode of failure, Figure 2 gives an overview of the failure modes of all the fracture specimens. Failures are mainly adhesive, irrespective of conditions of surface treatment. There are no remarkable differences in the failure patterns among all the groups. And Figure 3 represents SEM micrograph of failure mode, which A is adhesive failure, B is cohesive failure in bonding, C is cohesive failure in resin composite, and D is mixed failure. For discussion, characteristic and thickness of smear layer is dependent on the type of instrumentation used. Most in vitro dentin bond strength studies were performed on dentin surfaces prepared with silicon carbide paper, which is not clinically relevant, as the smear layer created by silicon carbide paper is thicker but more loosely organized. Whereas diamond burr produced thinner and more compact smear layer. For carbide burr, the smear layer was less condensed when compared to diamond burr. The thickness of smear layer also varies by the abrasive grit site. With increasing abrasive grit site, the more thickness of smear layer was observed. For carbide burr, the smear layer was less condensed when compared to diamond burr. The thickness of smear layer also varies by the abrasive grit site. With increasing abrasive grit site, the more thickness of smear layer was observed. According to the bond strength test, one-way ANOVA revealed that the surface preparation is a factor that has influence on the microtensile bond strength. Therefore, the null hypothesis is that the dentin bond strength was not influenced by the type of smear layer, was rejected with p-value less than 0.05. The surface prepared by superfine diamond burr demonstrated the highest bond strength. Other groups, which were carbide burr, 600 grit silicon carbide paper and coarse diamond burr group, show no statistical differences. This could be explained by the smear layer characteristic. Firstly, the bond strength of self-etching adhesives was influenced by the thickness of smear layer. The recent study demonstrated that the smear layer created by coarse diamond burr and silicon carbide paper were thicker than those prepared by superfine diamond burr and carbide burr. The thick smear layer might buffer the acidic monomers, resulting in the lower bond strength. In addition, from the same study, it was demonstrated that the particle of dentin chips, indicated by the white arrow, will remain on the surface prepared by carbide burr. These dentin chips might act as a contaminant of the bonding surface. Therefore, the bond strength of dentin surface prepared by these instruments were significantly lower than that of superfine diamond burr. Further study comparing to two-step self-etch adhesives might be required for more information. In conclusion, the characteristic of smear layer is dependent on the instrument used for preparation of the dentin surface. In order to achieve favorable bond strength, Superfine diamond burr is recommended for tooth preparation when using universal adhesive. Finally, this experiment would not be accomplished without the support of Assistant Professor Dr. Phipop Saikao, my major advisor, and Associate Professor Dr. Pison Senawong, a highly co-advisor. Thank you.
Thank you for your presentation. Any question? And if anyone have question, you can ask her, please. If anyone have question, you can write in the chat box. Okay.
Okay, so if there is no questions, I have just one question for you to ask about the ideas. First of all, nice presentation, Dr. Chantima. I just want to ask you about the idea as a result from your studies. In terms of clinical application standpoint, do you recommend to use the superfine diamond burr for cavity preparations?
If it's possible, the superfine diamond burr may be a good choice for finishing the cavity after preparation. Yes.
Yes. Yeah, I agree with you, maybe so you can get a nice and smooth preparation, and also you get the benefit as your study review that, right? Okay, I agree with that. Okay, thank you very much for the answer. ขอบคุณค่ะ